Okay, all right, well, we'll call this meeting of the Community and Health Services Standing Committee to order. Roll call, Miranda.
Miller,
Here.
Brewer, Kramer,
Here.
Glassbrenner,
Here.
Harwick, McGuire, Ferris, Braithwaite,
Here.
Chicker, and then Mr. Chair.
We'll make quorum. Okay.
You have
And
five.
you're in compliance with open meetings law,
Yes, ma'am.
posted, okay. Can I have a motion for approval of our 14-point agenda? Oh, and on that note, we are going to move number 9, the opioid settlement grant funding up to, right after public comment. That's okay with everyone. So do I have a motion from anyone to approve the agenda?
I'll make the motion.
I'll second.
All right, all those in favor, please say aye.
Aye.
Any opposed? All right, any corrections or changes to the minutes? We had a lengthy meeting last time, so it was a lot of minutes, but anything you noticed? If not, I'll declare those approved and we'll move on to public comment number 6. Is there anyone here from the public, online or in person, that would like to speak? Okay, so then we will go to number 9, discussion and possible action, approval of the opioid settlement grant funding for the DARE program.
And I can speak a little bit here, Ingrid. I just want to remind this committee that the county is in receipt of opioid settlement fund dollars. We do open them up for grants, is what this committee and full county board has decided will happen with those funds. And we did receive a application from the sheriff's office for funding for the DARE program.
Thank you.
Yeah, so I'm Lieutenant Mike Sizz. For all of you who don't know who I am, we submitted an application for the opioid grant in the amount of $6,000 to start a DARE program. You may be wondering why DARE or why now? We have been teaching Counteract since well before my time at Ithaca schools. And I think a year ago or two, we received an email stating that Counteract was no longer going to be a program. So luckily we thought ahead. We ordered 2 or 3 years of supplies so we could continue to teach Counteract to the children while we figured out what type of program we would like to move to. After some research, we decided to do DARE. Most of you probably know that name from maybe when you were in school or prior to that. I got DARE when I was in school. It's a worldwide program that's taught to children of all ages. It's evidence-based, it's successful, it's got a lot of research behind it. I think a while ago, some research did come out that it was not very effective. So they have since revamped it and made it a little bit more modern with their Keeping It Real initiative. There's plenty on their website that kind of shows recent studies about its effectiveness. One of the major points, I know this is for the opioid grant, which it does talk about drugs, alcohol, violence, and stuff like that. But DARE is one of the unique programs that actually addresses vaping, which is a big problem in our schools. And I know Counteract for sure did not address that. So that's very good. Also, I was asked by Ithaca schools to do a firearm safety talk just before rifle season. And we were able to find videos online through this Keeping It Real program through DARE that had great informative videos that we could play to the kids. They were broken up between K through 2 and then 3 and 3 to 5. We played those videos, went in and talked, even though we're not DARE certified, and we got some really positive results from that. They really appreciated that. Just got a call this morning that they wanted us to teach a summer school program about that. So they were very happy with that. A little bit of the breakdown of why we're requesting $6,000. The 2-week class, so it's 2 weeks of training. We would send myself, most likely. It's $1,250 for that class itself. So a hotel room we have on here for 10 nights at the estimated state rate of around $100, which would be $1,000. The food for 10 days while I'm there at the county rate, what they reimburse us is $25, so that would be $250. The work booklets that we need to purchase through the program, you can get 100 booklets for $165. So we just ordered 100 booklets. That would potentially last us 3 to 4 years depending on the Ithaca class sizes. Also, I have in here $400 for supplies. So once the class graduates, they would get a certificate, a t-shirt. If you've been through it, there's erasers. You could really go down a rabbit hole with the things you can order. I felt that 400 was pretty low, but I think after we get the initial equipment, we can probably start to budget for what we would like to buy, and then maybe Ithaca would buy into that as well. And then the last thing would be the officer compensation for the 2 weeks of training. So while I'm away at training, I would not be here assisting in my job duties. And then I just have my rate there for the 2 weeks of training, which would be just under $3,000, which would get us to $6,000. So I did speak with Ithaca School. I was not clear on if they were putting any money towards the Counteract program, or if they had a budget line for that. They do not. They just said that they normally just found it within their budget to pay for booklets or shirts or whatever else. And with them just going to referendum, I thought it would be helpful if we could potentially use this grant to start the program and give them a little while to kind of figure out how they're going to budget for it moving forward.
Thank you.
I just want to add, I'm a retired elementary teacher and have had DARE in my classroom for many years, and I can testify it's a very good program.
Sure. Yep.
Questions or comments? Mary, do you have any questions or comments?
Oh, I was just wondering if he'd have enough money if some of the other schools other than Ithaca wanted to be participate in that. Are we going to get into something that other people might want?
Right. So Richland Center, so we as the county only teach at Ithaca. It's the only rural school in our county. Richland Center Police Department has developed their own program. It's called PETE, that they are currently running in the Richland Center schools. I guess that wouldn't be our decision to teach DARE at those schools. The reason we didn't want to develop our own program is just because of all the history and the studies that have proven this effective. We like to have that base behind us, that training, the materials, and all that support. So that's the reason we chose DARE. But I definitely think if it goes well, we could talk to the city and see if they would like to adopt it.
Thank you.
And Weston is considered
Sauk.
Sauk County?
Yep.
I was aware that.
Yep, we have a bunch just on the border, Riverdale and Kickapoo and Weston, but they're all just out of the county. So we only teach at Ithaca.
So for the 2 weeks that you're gone, is there coverage for you?
Yep. So we kind of control our own coverage as far as allowing off vacations and stuff like that, as far as road coverage. My job specifically is more of an administrative office job. So there wouldn't need to be anyone that could cover as far as road coverage. Sheriff Porter, Chief Deputy Wallace can handle the tasks that I do on a normal daily basis while I'm gone for 2 weeks. So that's kind of unique. And also so I live in Ithaca. I've been teaching Counteract for the last, I think, 4 years. And it's nice to go there and know the kids. I know when I walk in now, they're all like, "Hey, Officer Sis," and I know them by name. I know their faces. They have someone that they can come to if they ever have questions or anything. And that's why I would like to be the DARE instructor, is just to continue that, relationship with the school there. So.
Great. Further discussion, or are we ready to vote? I guess we just discussed it without taking an actual motion, realize? So.
I don't have to say all that again, do I?
No. And I think when community, at the community level, it's not. So I do need a motion though. Any further discussion? Not at this point. Okay, all those in favor, please say aye.
Aye.
Any
Aye.
opposed? Okay, so then this will be forwarded on to the county board, and hopefully we'll address it at our next meeting.
Awesome.
Thank you.
Thank you for your time. Thank you.
Okay, so we'll move on to reports. HHS Director, Tricia.
So I do have a report in the folder with our updates for the last month. If anybody has any questions, I can answer them for you now.
I don't have any questions, but I just want to say thank you for always including those. They're very helpful to get kind of a picture of what's going on.
Thank you.
Anybody else have questions? Okay. 7B, expenditures report.
So those are the expenditures, I believe, and you can correct me if I'm wrong, Stephanie, that these have been approved by Candace.
Correct. They've been approved.
Yes. If there are questions on any of them, we can let you know what those expenses were for.
Okay, I know that was kind of our view one. Usually we discuss a little bit C, so 2024 HHS budget summary and the county placement report.
Yep.
Thank you.
So I don't know if you noticed, but this is through November, November final numbers in our finance system. What's different about this one compared to the other ones is now we're on the plus side, we're on the surplus side this time. That's because we did receive a very robust CCS WIMCR payment, so that brought us to the plus side. So I see the end of the year coming in good. We shouldn't have to explain a negative or a negative core budget balance at the end of the year. I think as far as specific units or whatever departments within the units within the department, public health is really high. But again, that's because we've been spending all of that ARPA money that we had that spending plan for. We're going to kind of slow down on that a little bit. Some of the bigger purchases have been made, but we did get notice that that money is available now through the end of 2025. So we'll revisit that and kind of see where we're landing and see what still needs to come out of that pot of money. Otherwise, I think the only other highlight is CCS. It's 103% utilization. It's another month to go. Again, that program's just growing by leaps and bounds. So the expenditures that we had budgeted are, they're obviously surpassing what we had budgeted. But again, CCS is 100% reimbursed. So, but yeah, so that's where the budget is right now for 2024.
So, you know, did we adjust for those? I mean, I understand that it's reimbursable, but did we adjust that in the 2025 at all?
Probably what I did in 2025 is I probably did like an average, like a 3-year average where we thought maybe our expenses were going to land. So,
Okay.
And I don't know that I necessarily
Oh, sorry.
budgeted at this level, but.
It's nice to see it in the positive though.
Huh?
I said it's nice to see this in the positive.
Yes, I know. I was a little nervous myself. I did find about $23,000 when I created the budget for 2025. I did a consolidation of some revenue accounts into just one revenue line. And so what I discovered was that when I deactivated those revenue lines, they stopped showing up in my revenue on this report. So I was able to find about $23,000 there. So I was happy. But
Yeah.
but yeah, so. And then if we switch to the placement report, you can see we're at about 76% utilization for adults, 75% for children's. Oh, children's didn't carry over to November. Just noticed that. Interesting.
So do you think that 75%?
It'll be a little bit
includes
higher,
November?
but it's still well within the,
Yeah.
yeah, it's still good. Yeah. So just take note that the children's is only through October, so we're okay there, but either way, we're gonna be okay. We're gonna end both of those placements. We're gonna end under.
Yeah.
So,
That's great.
yeah.
Thank you. Any questions, anyone? Appreciate that. So then 7D, contract monitoring report. I know we've got a couple contracts we need to address.
Yeah, so two we'll be planning to bring back next month are Diane's adult family home. That was one we were hoping we could get to the end of the year, but definitely will need to make a modification. And then the second one is Fiscal Assistance Incorporated. That one we've had it's way over only because we were having trouble getting access to the state system that tracks that. And so once we got access, we found that does need to be modified. And so we will be bringing that one back next month.
So on the monitoring report, what percent utilization should we be at?
It just varies depending, everything was through November, it's 92%.
Okay,
Yep. But as you can see, some of them are not.
right, through November.
I think a lot of them are through October.
Great. So that would take us to 8. If you guys don't have questions on that, we'll address those few that she mentioned. Okay, so moving on to 8, discussion and possible action. Resolution approving provider contracts for 2025 for the Health and Human Services Department. Trish, you have background? I know you just mentioned them.
Yeah, so last month, we brought to you many of the contracts for 2025 for over 100,000. As you'll recall, the new procurement policy indicates that anything over 100,000 does need to come through our committee and to full county board. So these are the 4 that we did not bring last month that we need to bring forth to you. First one is Diane's AFH, and that is a group home that we use through CCS. Our second one is Haley Schneider, and you may know we did bring that to you last month, but we had the wrong contract amount. We had it only for 100,000, and it really should be 140,000. So we are bringing that back to you. You Are Enough Counseling and Driftless Counseling are both service providers through the CCS program. So these are our 4 that we need to take to full county board for their approval. Any questions on any of these?
The driftless counseling, we've been utilizing that one for a number of years, right?
Yes.
Okay.
Yeah.
We just utilizing them more, that's why we need to adjust it?
So we never took this to you last month, but we do use them a lot, and we did modify, I think back in October. I think our original contract last year was just over 100,000, and we needed to modify it to increase it. We do use them a lot. They have a lot of providers. They also do some service facilitation for us, and they also provide some supervision to our workers. And so all of that is incorporated in there. But this is a CCS program, and all the money that is spent with them, we do get back 100%.
So is that number accurate that's listed there, the 1,500,000?
Yes, that is accurate.
Any other questions?
Yeah, so all of these people, we get money back.
Haley Schneider, we don't get back 100%. And Stephanie, if you want to jump in and explain a little bit better on that, but the other ones, we pretty much get back. Diane's AFH, the room and board, we have to pay out of our placement funds. But everything else that is paid towards her, we do get back. And then if Steph wants to explain Haley Schneider, she is our advanced practice nurse practitioner. That is funded differently. So I'll let Stephanie explain that.
Right, so Haley, as an advanced nurse practitioner, her contract is kind of split, so she does mental health. Some of those, if they're a CCS client, then we can bill her time through CCS, get 100% reimbursed. Otherwise, everything else, we do get a partial reimbursement, like 82% when we do the liquor every year, the Medicaid claim reporting. We get back, but the bulk of hers we would get just through direct billing, like insurance billing, Medicaid or any other sources that other insurance companies that her patients might have. It's a little mashup.
Okay.
I have a little follow-up on that. Actually, when you add all that up, what comes back to us, what is spent and what comes back to us, what's left over for the county? I know you don't have a dollar. General, what are we asking the county to pay for? For how much over, how much does the county actually, after you get all your monies and stuff back, about how much are we gonna ask the county to pay on this, on these people?
You mean like tax levy dollars? For all
Yeah.
of these, all of
Mhm.
these don't have tax levies, so if there's a hole that doesn't completely feel Hilly Schneider, we also have our mental health block grant, we have, yeah, I don't have any levy or base county allocation. None of these are levy.
Except Diane's AFH, the room and board cost.
The room and board piece out of the placement fund, yeah.
Replacement.
Yep.
So that really wouldn't be much for the county then.
No,
No.
Okay, all
Even
right.
that room and board piece, if they have an ability to pay, they also contribute towards their own room and board, so.
Okay, I just wanted to clear that up, what we're asking for.
Yep.
All right.
Thank you. All right, do I have a motion then to approve these contracts going to county board?
I'll make the motion.
All right, and a second?
I'll second it.
Okay, any other discussion or questions? If not, all those in favor, please say aye.
Aye.
Any opposed? Okay, that moves us down to 10, discussion and possible action. Resolution or approval of 2 new job descriptions for the Health and Human Services Department. Trish, do you have background or do you want the department?
I do. So I can start with that. So what happened was last year in July and August, we brought to you the proposal to create 2 new positions. In July, we brought the creation of a recovery services coordinator position, which would be grant funded and would sunset once the grant funds went away. And the purpose of that position would be to work with those that are struggling with AODA issues to get them connected to services in the community. At that time last July, you guys said, yep, you can pursue it. It was kind of backwards because typically we come to you with a job description that you approve and then we build it into our budget. Because we were doing the comp and class study, we kind of did it opposite. We brought it to you. Now we're bringing to you the proposed job description. So that is the first position. The second is the economic support supervisor in our economic support unit. There are 13 workers. And so for one, and a lead. And so for one manager to fully support the unit, provide the level of supervision, education, hands-on training that is needed, and oversight of them, we needed to build in a supervisor. So that was brought to you in August and was supported by this committee. Again, it was done backwards. We brought to you the concept of the position, and now we're bringing to you the job description for your approval. Both of these have been built into our budget. With the economic support supervisor, there is not county levy. We do beyond what our base county allocation is. We do have money in our budget for this position as we will be having one less worker and including the supervisor. If you have any other questions on that, please let me know.
I do have one question. So first of all, I appreciated you putting in the previous resolutions that we did approve because it's helpful. But did those go on to county board or did we just include it in the budget and it came that way? Do you remember?
That's correct. We just included in the budget. It never did go to full county board. In
Okay.
talking with Candace, she said we did not need to through that process. We brought it to you and now we just need to get the job descriptions approved. I've talked with Derek about it and he believes this is the correct way we should be doing this.
Does it then go to finance and executive next or does it go straight to county board?
In talking with Derek, he says it should just go to full county board, but if you guys want it to go to executive, we certainly can do that too.
I don't. I just anticipate we had already approved this, so I don't anticipate there being a problem at this level, but because it sounds to new job description, I anticipate you'll need to give some background at the county board meeting, so that they understand where we're coming from, which I'm sure you would have anyways, but.
Okay.
Did you guys get a chance to review over there's several documents for each one. Do you have any questions? Their supervisors are both here if you need to for department heads. No. All right, well then, if you guys are comfortable, we can move on to voting on it. Do I have a motion for it?
I make the motion.
Okay, Mary and then Sandy. All right, so any further discussion? All right, all those in favor, please say aye.
Aye.
Any opposed? Okay. All right, number 11, discussion and possible action, resolution recognizing the retirement of an employee of the Health and Human Services Department.
So Kathy Dobbs retired last Friday. She worked for the county for over 37 years. And so we would like a resolution that recognizes the dedication and commitment she made to the county. I'm guessing Stephanie will want to share more because Kathy was in Stephanie's unit.
Right, so for sure, 37 years. I did do a quick shout out. She's worked for the county. She worked in UW Extension. She worked in the Veterans Office, County Clerk's Office for years. But she's been in HHS since I started 13 years ago, so, and always been part of the fiscal unit. Does a lot of the billing and everything, did the billing for our CLTS program, our Group 3 program. She pays all the bills, so these reports you see every month, she's the one that's been putting those together for you, so. A lot of institutional knowledge just went out the door, so big shoes to fill, so. Very happy for her. We miss her already. She's been gone three days. But we're, we're hanging in, so. I wanted to recognize her for 37 years.
Yeah, that is. Great, well, do I have a motion to move this? Francis?
Okay.
And then
All right.
Sandy?
Yep.
All right, all those in favor, please say aye.
Aye.
Any opposed? Okay, number 12, do we have any correspondence?
We do not.
Number 13, any future agenda items that are not expected, I guess? How about from committee members?
No.
Anything? Okay. Our next meeting, I believe, would be February 6th at 9:30. So I would take a motion to adjourn until then.
Okay.
Thank you, Francis. Do I have a second? All those in favor, please say aye.
Aye.
Any opposed? All right, thank you. Thanks, Trish. We got you out of here with 3 minutes to spare.
Wonderful. Thank you. Have a great day,
Yes.
everyone. Bye-bye.
Appreciate you. We were able to reschedule that.
Yeah.